Hi, my name is Leigh Evans and I work at Apt Associates. I wanted to tell you a little bit about one of our projects. That's an evaluation of the 6 building blocks for opioid management, or the 6 BBs. So the 6 building blocks is an approach to help primary care practices curb opioid prescribing and manage patients with chronic pain on long-term opioid therapy. So there are 6 different areas or building blocks that practices could focus on. These include things like building leadership and consensus, developing patient agreements and managing workflows, measuring success, and tracking patients. So each of those areas is a separate building block that the 6 building blocks focuses on. So we're evaluating use of an implementation manual to help practices get up and running with the 6 building blocks. And this poster just reports some preliminary findings from that evaluation. So one of the things that we learned is that practices chose to participate in this project because it really aligned closely with work that they were already doing. So they weren't starting from scratch. A lot of them already had a lot of the 6 building blocks elements already there. So they use this project as a way to really dig in and to do more work in each of these areas. Some of the 6 building blocks were more mature than others in practices. So they're really focusing on where the gaps are. Practices have reported good experiences with using the implementation manual that we have developed. Some are choosing to kind of go through step by step really linearly, and others are kind of picking and choosing what things align with what their clinic's doing now and really kind of jumping through the guide and using it in bits and pieces. So we thought that was kind of interesting. We also did a survey of clinical staff. It included a lot of different things, but one of the things it asked them about was some of the barriers that they face related to providing care to patients with chronic pain on long-term opioid therapy. Some of the barriers that they reported to us were things like social determinants of health that their patients are experiencing that make providing care a little bit more difficult. Another barrier was that new patients are coming in who are already on opioids, so it makes it more difficult for clinical providers to kind of taper them down. And a third barrier that they were reporting to us was that there is some patient resistance around reducing opioid prescriptions. So that was another barrier. We're really excited to continue doing this work and see the continued results from the evaluation. And we really think that the 6 building blocks is going to be a useful tool to practices, and we hope that this implementation manual could really get out there and help practices do this work and use the 6 building blocks to really tackle opioid prescribing in their practices.